know someone who is pessimistic? I believe we all do. But just imagine having to work with a patient who is very pessimistic in a mental health or in medical settings. It can be really, really challenging. Their negative outlook or how they view things can actually create obstacles even to the treatment or any intervention that you try to offer to them. One of the challenges is resistance to treatment. Many patients that come to seek for help, they will literally think of the worst possible situation to that antidepressant, to that treatment, to that therapy, to any intervention that you try to provide. The second thing is that they will go on to engage in what we call catastrophizing, which means that any kind of treatment they are really you're offering to them, they are thinking the worst possible position. What's gonna happen? I could take this now and I can go down, or maybe this is the life sentence to me. I'm gonna be on this journey for so long, which could often lead to hopelessness, whereby they will not actually want to take any kind of active step towards their treatment or make any proactive changes in behavior or anything because they feel so powerless. Like, this is it. Can even become so pessimistic even about you to the extent that they don't even trust you. They've come to you to kind of seek help, but they don't trust the doctor, they don't trust the therapist, they don't trust any kind of help that you're trying to suggest to them. So they kind of go into kind of like self-fulfilling prophecies of why they should not engage in those kind of things, why they should not engage in the treatment or whatever interventions that you're offering to them. Even you as the professional or even the providers can become really emotionally drained because they are not seeing the progress and this kind of patients. Like, you've offered everything. Maybe they've even tried various stuff, but they've not actively given themselves to it. And you don't even know if they're actually fully engaging in those treatments. So it's like it's just a cycle because you're trying to like figure out what could be happening. We've tried this, but this is not working. There can be difficulty in terms of a behavioral change. Why? Because a pessimistic patient will tend to focus on all the past failure. Like, I don't know if you are a healthcare professional, you would have seen the patient as walking and I've told you all the various treatments they've tried. They've talked about all the various professionals that have been involved in their care, and immediately they come in, they're literally telling you that I don't even think whatever you're going to say or whatever intervention you have here is going to help me, because they always fail. It doesn't work. It never works. So the moment they walk in, they've already walked in with that kind of mindset of like, this is not gonna work. It's not just gonna work. But what can we do? Is there any way you can help these people? Is there any way you can help this group of patients in order to make those changes? So you want to do when you have this kind of patient walk through your consultation or through your therapy session, first thing, you want to validate their feelings. You want to acknowledge that the struggles, their feelings are valid without paying any much attention to their negative outlook. That is something. Then the second thing you want to do, you want to use behavioral techniques to kind of change those negative patterns of thinking and provide an alternative perspective to that. And the third thing you want to do is set small goals. Set small goals, achievable goals are very key. They don't need to kind of like work on big stuff. Can just be very little stuff, which will slowly shift their mindset. And then also you want to celebrate those little success, even those times in the past where they've done something and they've been successful, trying to alight those strengths to them, to say, what about this time that you did so and thing? What do you think? Those times that you were going through these difficulties and you were able to overcome it. You understand? Like, being able to alight the strength to them is very important. Encouraging mindfulness, meditation, gratitude is very important for them to kind of develop a more positive mindset and shift their mind from the negativity. It's so key. So encourage them. If something might not be for everyone, but you'll find out that for those who have not done it before, it's something you can offer to them. I remain your one and only girl knows better. If you like this video and you know someone who you think it might be helpful for, why not share it with them? And also give this video a thumbs up and click on the follow button or the subscribe button for more updates.